Hi, crackheads. Dr. Chris here. Welcome back. Thanks for tuning in today. Today we have our pop star Jaime, and Jaime is a professional model and 4X trainer. Thank you for joining us today. How are you doing?
Good, great to be here.
All
For
right.
my adjustment.
All right, good. And we've been adjusting Jaime for a while. Can you tell everybody kind of what's been going on with you, what your story is?
Well, first of all, I do know the importance of having regular chiropractic care, which I used to have, and it's been a while. And what brought me back in to Dr. Chris is the fact that I had a really bad mattress while it was expired, and I noticed lower back pain, and so I figured I needed to be adjusted. So I came in to see him, and I found out I was terribly out of alignment, and the lower back pain was caused from the bad mattress. So he's been helping me to get back in alignment, which I love.
Yeah, yep. So we've been, again, we'll talk about kind of the importance of having a good mattress. All right, so we spend, 6 to 8 hours of our days every single day sleeping. So it's really important to have what I call good sleep ergonomics, right? Like we always think about how sitting in a chair for 8 hours every single day can cause back issues. Well, same thing. Sleeping in your bed for 8 hours a day, having bad ergonomics and posture can also cause back issues. All right, so we'll talk about that, but let's get Jaime down on the table and let's get started. You ready?
Ready.
All right, perfect. I'm gonna have you lie face down. So facing the paper there, arms down below your head. All right. Okay, let me have you, you're gonna need to slide down toward your feet a little bit. Okay, make sure you're more. So make sure your face is in the paper there. Okay, you're like an inchworm, a little. You're going like 1 centimeter at a time. Okay. All right, good job. That'll do for now. Okay, so let's talk about sleeping since Jaime's problems have stemmed from her mattress. So first of all, your mattress is very, very important. All right? You want to have, I recommend, as firm of a mattress as possible that you're still comfortable with sleeping on. Okay, so if you feel like your mattress is too soft, what I recommend is going to a mattress store, asking the salesperson for the most firm mattress they have, and lying on it. All right, see how that feels, and see if that's comfortable or not. If it's uncomfortable, ask for the next level down, and then keep going until you find a mattress that's comfortable, but yet still firm. And the reason why you want a firm mattress is because that you want your spine to be supported while you're sleeping. If your mattress is too soft, you sink into it, that throws off the curves in your spine and ultimately can cause misalignments and back issues. So with that being said, a good remedy for back pain is sleeping flat on the floor, because the floor is going to be the most firm surface that you're going to have available to you. So if your low back is really bothering you, I would recommend trying to put down a blanket and then try sleeping flat on the floor. That's going to provide your back with the most support, and you're going to feel better when you wake up. The other thing that you want to remember when sleeping is your position. All right, so most people either sleep on their backs, on their sides, or on their stomach. Okay, first of all, you want to avoid sleeping on your stomach completely. Sleeping on your stomach is the worst position for your back. Okay, first of all, when you sleep on your stomach, you over or hyperextend your lumbar spine or your lower back. That puts a lot more pressure on your back. You're going to have back issues. And then the second issue with sleeping on your stomach is you naturally have to turn your head to the side. So then you're sleeping already with your head kind of kinked, and then you're going to wake up with that kink in your neck. All right, so you want to try avoiding sleeping on your stomach. You can sleep on your side or your back. Those are both good positions to sleep in. Just some keys to remember. If you sleep on your side, you want to make sure you put a pillow in between your legs to keep your hips in line. Okay, real quick. It's because if I asked you to stand normally, you would stand and there'd be separation here, right? Because your hips are in line. So if you're sleeping, why would you want to sleep like this? This compresses your hips, it throws your hips out of alignment. All right, so if you sleep on your side, again, you want to put a pillow in between your legs to keep those hips in line. Okay, and then if you're sleeping on your back, the one thing that you can do to help with low back pain is to put a pillow underneath your knees. All right, keep your knees bent, and that'll take pressure off of your low back. Okay, so those are just some tips for good sleep ergonomics and for picking a good mattress. Okay, so now let's get Jamie all put back in place here. You ready?
Ready.
Okay, so I'm going to feel your spine. If you have any pain, I want you to let me know, okay?
Mm-hmm.
Already a little bit off to the left here at the top. Okay, any discomfort through here?
Not really, no.
Okay, good. Most of your problems are lower, right?
Correct.
Okay. Okay, a little off to the left. Again, the CT junction is a area that we almost always adjust. There's always misalignments here because it's when two alternating curves come together, your cervical spine and your thoracic spine. So pretty much what we want to do here is, since we're off to the left, all right, I'm going to come over to this side. Okay, tissue pull these joints over to the right and then set them back down into place. All right, I'm just going to move your head to the side nice and easy. Good, just relax. Good, you can look straight down. All right, perfect, that was great. Okay. All right, and then your thoracic spine's a little off to the right here. Okay. So we're going to pull these over to the left. Same thing, give me a big breath in. Good, and let all the air out. Good, nice and easy. Good. Okay, perfect. Okay, so now we're going to come down to your lumbar spine. All right, if you have any pain, let me know, okay? Pain around here?
Mm-hmm.
Okay, so right at the very bottom at L5. Okay. So again, we're just checking for any rotation here. All right, and L5 is rotated a little off to the right side. Okay, so we're going to use the activator here. All right. So just relax. Okay, nice and easy. We're going to tissue pull to the left. Tap this joint back into place, okay?
Mm-hmm.
Just checking the muscle tone here as well. Feels a little tight on this right-hand side. So the cool thing about this tool as well is not only can we adjust the joints with it, but you can also kind of stimulate the stretch receptors in the muscles as well. All right, so we're just going to give these a couple little taps, and that's going to help to reduce these muscle spasms. Okay. All right, good. Now we're going to check our friends, the SI joints. Okay, because again, SI joint dysfunction is one of the main causes of lower back pain. So we want to make sure these SI joints are in place. So we're going to check your tailbone first. So Jamie, let me have you keep your right leg straight. Raise it as high as you can, straight up off the table. Good, you can let it down. A little tender. Okay, and then do the same thing on the other side. Okay, that side hurts. Okay, just relax, you don't have to push it. Okay, so since the left side was harder, I want you to cross your left foot over your right foot, please. Okay, just at the ankles, good. All right, so your sacrum or your tailbone is rotated counterclockwise. Okay, so we're going to spin that back into place. Table's going to come up, drop back down. Okay. All right, good. Just relax. So a little bit about this adjustment. All right, so we're trying to spin the tailbone back into place. So first we're opening up the SI joints. So I'm contacting the right PSIS, opening that up, and then I'm gonna swing the sacrum back around with my right hand. The reason why we cross the feet is that opens up the left SI joint. All right, so I'm opening up the right one with my hand, and then we're spinning the sacrum back into place. All right, you ready? Okay, nice and easy. Good, 2 more. Good, last one. All right, good. You can uncross for me. Okay, so let's check that. All right, so I want you to do the same thing. Keep your right leg straight. Raise it as high as you can. All right, good. You can relax, and then the other side. All right, better, right?
Better.
Okay, cool. Perfect. So that worked out well. All right, got that sacrum back in place. And then now we're going to check your leg lengths. We want your legs to be the same length, right?
Correct.
Not bad, actually. Okay, so Jamie's right leg is a hair shorter than her left. Not bad. All right, so again, with the leg lengths, that shows us which the hips are out of alignment, okay? So again, we want your hips to be even, but what happens is if you want to come over and look at this, I don't know what your angle looks like. So just with my hands, imagine these are your hip bones. So what happens if your right leg is short in this example, the right hip rotates posterior and inferior, and then the left hip rotates anterior and superior. All right, so instead of being like this, Jamie's hips are like this. All right, so I'm gonna push those back into place, and that's gonna remove that SI joint dysfunction. All right, we ready?
I'm ready.
All right, perfect. Let me have you turn on your side, face towards me, please.
Is that why the right side hurts?
Well, so the SI joint dysfunction can affect both sides, either side. Yep. Okay. All right, good. Cool. Arms here. Good. Bend this knee. Good. This leg straight. Okay, good. And then just relax. Nice and easy. Gonna push this hip back in.
Oh.
There you go. Good. That was a good one. All right, perfect. Let me have you turn to the other side. All right. Good. That hip moved great. All right, perfect. Same thing. Arms here. This leg straight. All right, good. And then, so on this side, again, this side is the one that's rotated anterior and superior. So we're going to contact lower, and then we're on the ischial tuberosity, and we're trying to pull this hip down. All right, so good. Just relax. You all right?
Yes.
Good. Nice and easy.
Oh.
There you go. Good. Perfect. All right, good. You can lie on your back for me. All right, great job. That moved great.
Yeah.
Those were
Felt it.
some satisfying cracks, right?
Yes.
All right, perfect. And hips look good. All right, so everything's lining up great. And then now we're just going to check the neck. All right.
I never knew how important a mattress could be.
Yeah, I know.
Oh my gosh.
Yeah, that actually causes a lot of issues. And just a good rule of thumb as well, talking about the mattress again, you want to look at getting a new mattress every 8 years or so. This is a general rule of thumb for that. Okay, let's see what we got here. Also, since we're adjusting the neck, another critical piece of sleeping is the pillow that you're sleeping on. So again, I'm kind of big on sleeping ergonomics. I think it's really important. Again, like you can cause just as much damage sleeping in a bad position as you can sitting in a bad position. Same exact thing. So you want to have a good mattress. You want to sleep on your back or side. And you also want to make sure you have a good pillow. All right, so they make cervical pillows. And cervical pillows have a cutout for your head. So while you're lying on your back like this, your head sinks down and then there's a support for your neck, and that restores the cervical lordosis in your neck. All right, so you want this curve. All right, so if you're having any type of neck issues, any headaches, especially first thing when you wake up in the morning, research and invest in a cervical pillow. Okay, let's see what we got. So just relax for me. Okay, just feeling for motion as usual in all the joints in the cervical spine. If you have any pain, let me know, okay, Jamie?
Mm-hmm.
You're doing great. Nice and easy. Good. Perfect. Okay. And then last one. Good, just relax. Any pain?
No.
Neck's moving good. A little tight at the bottom here, same thing, nice and easy. Woo! Heard that. All right, that was a good
It
one.
may sound louder in my head. I don't know.
Those are pretty loud. I think our crackheads will appreciate that one. All right, Jamie, perfect. Good job. We just put everything back in place. Let me help you up. All right, come on up. All right, beautiful. So we just put everything back. How do you feel?
It was a little painful, but good. Well worth it. Thank
Good. You feel relieved now?
Yes.
Awesome.
Yeah,
Perfect.
to
Well,
an
thank
extent.
you so much for coming in.
Thank you.
Appreciate it. You
Yeah.
did great.
Thanks.
And then thank you guys for tuning in today. We appreciate it. Make sure you subscribe, like the video, tune in next time for more satisfying cracky cracks. And remember, I got your back.